Hello, my name is Daniela. I'm here in 2.0 conference here with Chad. We're going to ask you some questions today. Please introduce yourself and the organization you are representing today.
Yeah. So my name is Dr. Chad Beauchamp, owner and founder of Repair Sports Institute in Huntington Beach, California. We're a sports medical wellness practice that does a collaboration of both Eastern and Western medicine through a multidisciplinary approach with many different medical professionals such as physical therapists, chiropractors, acupuncturists, sports massage therapists, sports recovery specialists, orthopedic surgery, and regenerative medicine.
Oh, great. So here you said you are in a CXO 2.0 conference and honor. So how do you feel about receiving that recognition?
Yeah, it's been awesome. Yeah, I think anytime that you are very passionate and put a lot of hard work and have been through the trials and tribulations of owning and practicing a company, it's always nice to take a moment to have gratitude, and it's nice to be recognized by others for the accomplishments that you've been striving for a while. And it's not about me, but it's really more about my company and the employees that I have that work so hard in order to advance the industry and help each and every one of our patients.
So it's like a teamwork
Absolutely.
altogether.
Yeah.
So what advice you will give to someone that is want to follow you in your footsteps right now, the new generation? What advice you will give them?
Yeah, I mean, the advice I would give is, if you're going to start your own company or go down the path of being a doctor, whether it's a surgeon or a rehab specialist, is definitely make sure that you're extremely passionate about what you're doing. And again, taking the time to give yourself a little grace, because it's not easy, especially running and starting and operating a business.
Yeah.
There's a lot of challenges with that. So that's where the passion part comes in. You really have to be passionate in order to push through those challenges. But along the way, too, is also give yourself grace. It's not going to always be roses and butterflies in this, happy old time. It is challenging. But with all the small victories that you have each and every day, make sure that you give yourself some gratitude and be appreciative of that.
That's great. And also, since how's been your networking experience so far in the expo? I know we just opened today.
Yeah, it's been good. Met a bunch of awesome people. I just spoke on a panel about an hour ago. We had 5 or 6 people on that panel, and it was great. A bunch of different backgrounds, from an OBGYN to some people in the technological industry working with AI, some massage therapy, and then myself. It's been really good to connect and see that we're all on a similar mission to continue to push forward our healthcare industry. So it's been awesome. There's a lot of great people here.
Yeah, sharing a lot of knowledge.
Yes. Yeah.
So where can others can reach you for advice or collaboration? Do you have a website or?
Yeah. So you can find us at repairsi.com. That is our company based out of Orange County, California. We're also on social media platforms. Instagram is at Repair Sports, and you can find us on Facebook, LinkedIn at Repair Sports Institute.
Okay, and also I want to ask you, what are some of the main issues you see in the U.S. Healthcare system right now?
Great question. There is a handful. I look at our healthcare system as more of a sickness management system. It's not necessarily about healing individuals. Now, there's a time and place for more invasive type surgeries or medication that is needed, and we're very grateful to have those services and access to that in the United States. However, it needs to get back to being preventative in a lot of ways, working on people's actual health from a nutrition standpoint, knocking out processed foods to get rid of high blood pressure or, diabetes, managing blood sugar levels. There's a lot of ways that we can holistically prevent a lot of the diseases that we have. And that's really where we're trying to come from with my company, is go more on the preventative side, give people the tools and education in order to be a self-advocate for themselves and not just rely on what certain doctors are telling them or what the insurance will cover, what medications they need to be on the rest of their life. So in a lot of ways, that sickness model has a lot of downsides, which, I'm hoping and I'm optimistic that with conferences like this and people like myself can come together and we can push forward and truly have a healthcare model in the future.
Yeah, so you're saying more like implementation of nutrition knowledge, and that's what everything started to prevent.
That's one aspect of it for sure.
Sure. What separates repair from the clinics?
Yeah. Our company really separates ourselves from a lot of other facilities because of the multidisciplinary approach. So having a team of medical providers work together to give the patient the most optimal health plan.
Yeah.
A lot of times patients have a physical therapist over there, their MD over here, acupuncturist over there, massage therapist over there. Nobody's really talking. So we bring all those providers under one roof, one plan of care to work together to give the patient the best care possible. But we also really think outside the box as far as combining the Eastern and Western medicine. So trying to heal the individual, get them in touch with themselves from an energy standpoint, working on emotional trauma healing, giving them a lot of tools to be connected back with themselves. So and again, a lot of times pharmaceutical medications get them disconnected and they have a lot of issues, and then they get more pharmaceutical medicines to try to help them with their stress or depression and so on and so forth. And so we really try to, again, think outside the box to connect them with themselves and get more on that healthcare preventative plan. And we pay attention to a lot of the details. Our clinic is very friendly and inviting to the patient. It's fun. You know, we have music going, the sound, the attention to details of how it smells, the lighting in there. So it's a place that people truly want to come to and stay at and have a good time versus the typical healthcare hospital that's kind of bright lights, stale, no colors, don't really want to be there.
So it's more like also customized for each
Absolutely,
person,
yeah.
which is great.
Definitely.
So what were some of the challenges with building and operating a clinic like Repair?
Yeah. Well, some those challenges are dealing with the way the healthcare system is, right?
Yeah.
You're part of the insurance model, so thinking, again, outside the box as far as what insurances are you going to take, being in and out of network based on the different insurances that can help cover your costs.
Yeah.
Not becoming a high, patient volume clinic. So again, having the team approach, having a patient come in to see physical therapy, going into acupuncture, into these other services allows the financial stability to be a little bit more broad. And with that, as much as it now works, there was a lot of challenges with that, figuring out what works, what doesn't work. And then just being a small business in general, having in a service industry especially, you have a lot of employees that you have to manage, a lot of people that you need to take care of and make sure that they're happy, because if they're not happy, how are they going to be able to provide the best care in order to help the patient? So that's a couple of the challenges that I've had to deal with, but because of the passion and pride that I have with what we're doing, we continue to push forward.
That's great. That's great. Do you have anything else that you want to share with us today?
Well, again, it goes back to, if you're really passionate about something, I highly suggest that you work extremely hard, you follow your passion and give it all it takes in order to be successful with that, and make sure you have a community of people around you, whether it's family, friends, or colleagues. Come together, have open dialogue. No matter if your viewpoints are different, that open dialogue can be very successful in order to push forward and be a better place than we are today with our healthcare.
Well, thank you so much for being here. It's a pleasure to having you and your knowledge.
Thank you so much.
Thank you so much.
Yes.